So hello everybody, we're from SGD 5 and today we would like to explain about the effects of Reiki on anxiety. My name is Alisa Kamal, student number 156, and I explain about the introduction of the speaker. Mental health disorder is a state that can be characterized as an abnormal combination of thoughts, perception, emotions, behaviors, and relationships with others. One of the examples is anxiety disorder. Reiki has been used widely these days to treat mental health disorders. Reiki is one of a variety of complementary and integrative therapies and a practice of mind-body healing that can increase awareness, relaxation, and comfort. In the student project, we would like to explain more about Reiki and anxiety disorder, as well as the relation of Reiki and anxiety disorder that can be useful for the extension of someone's knowledge and further research. Thank you.
My name is Udayana with student number 181. Today I'm going to explain about the problems, purpose, and benefits of this paper. So the problems are: what is the definitions of Reiki? What are the techniques and principles of Reiki? What are the procedures and how Reiki works? What are the conditions for using Reiki? What is the definition of anxiety? And last, what are the benefits and effects of Reiki with for people with anxiety? And the purpose of this paper is to answer all of the questions above. And the benefits of this paper is to make a better understanding about the effects of Reiki on anxiety and make awareness about this technique. Second, the significant benefits of this paper for author is to give a better understanding about the effects of Reiki on anxiety and also to give more experience of scientific writing. Third, the significant benefits of this paper for other institutions is to add more reference to the institutions about the effects of Reiki on anxiety.
I'm Wanda with student number 133. I'll explain about the definition and the brief history of Reiki. Reiki comes from the Japanese language, namely from the words Rei, which means universal, and Ki, which means life force. Reiki is a technique to stimulate the natural mechanism of restoration and maintenance of health using the laying on of hands or touch. Reiki was first discovered by Dr. Mikao Usui in the 19th century. In 1921, he opened a clinic and started holding workshops to spread Reiki.
My name is Safina Gisitandi with Trila student number 048. Dr. Yusui twins retired naval officer named Jujiro Hayashi as a Reiki master. When Yusui died in 1926, Jujiro Hayashi continued to spread Reiki and found the first Reiki clinic. In 1935, Jujiro Hayashi met Hawayo Takata, who was a patient with biliary disease complicated by a serious respiratory condition. Takata received Reiki for 4 months at the Jujiro Hayashi clinic. When he finished his treatment, Takata received Reiki training and returned to his homeland of Hawaii and set up a Reiki clinic in Kappa. Takata spread Reiki to the mainland of US, to Canada, and Europe. In 1980, Takata founded the American Reiki Association to coordinate the spread of Reiki knowledge.
The techniques and principles of Reiki. So the techniques of Reiki are centering, clearing, beaming, extracting harmful energies, infusing, smoothing, and raking the aura. Meanwhile, the principles of Reiki is considered to be the secret art to invite happiness, and as Kotodama, which is spoken out loud words, makes its power and spirit come alive. The principles of Reiki are just for today, or Kyodakewa, do not anger, or Ikaruna, do not worry, Shinpai Suna, be grateful, Kansashite, do your work, Gyo Hagime, and be kind to others, or Hitoni Shinsetsuni.
Hello, my name is Putri Agnes Monica. So I will explain about the procedure of Reiki as an energy therapy. So there are 5 steps for Reiki. First is take off the shoes and the soles of the feet touch the ground. Relax and the position of the 2 palms open above the thigh. Second, back straight. Easy to give enough space for internal organ at work and blood flow. And the third is bare feet touch the floor is affirmed to get rid of negative energy into the earth. Fourth is palm open hand. So is it for activate chakra palms in receiving distribution energy. So the last is the physician will touch part of bodies or a few centimeters above patient bodies to recharge patient energy, especially the parts of bodies with problem. So now I will explain about how Reiki works. So the Reiki methods puts the patient into an alpha state. So what is alpha state? Alpha state is a state when someone calms down. adrenaline works down, the works of the pituitary gland slow down, and the breathing and also heart rate slow down. So for this response is called a relaxed response. So when our body is in relaxed response, our blood flow will run smoothly and sedative neurotransmitter will be released and the nervous system will work well.
My name is Krisanta Paramita Kornemaya with NIM 170. For patients with chronic illnesses and diverse medical conditions, Reiki can be used as complementary therapy to reduce pain, stress, depression, and anxiety, even up to 3 months after completing the treatment. Stress causes increased heart rate and blood pressure due to sympathetic nerves activity. Meanwhile, Reiki causes vagal nerves to be more activated. This means that Reiki is able to activate the parasympathetic nervous system, resulting in reduced heart rate and blood pressure, hence reducing stress. Reiki has also been found to enhance self-esteem and quality of life of chronically ill patients. For example, Reiki improves blood cancer patients' general, physical, social, and even environmental dimensions of quality of life. For patients with mild Alzheimer's disease or mild cognitive impairment, it can significantly improve their cognition skill.
And my name is Tia Yusutari, student number 173, and I'm explaining the definition of anxiety and its symptoms. So, the definition of anxiety is variable. However, most definitions stated that anxiety is part of human nature, which is the feeling of anticipated anticipation of a future danger or negative event, accompanied by feelings of dysphoria or physical symptoms of tension. Symptoms of the general anxiety disorder are feeling restless, on edge, being easily fatigued, having difficulty concentrating, having muscle tension, difficulty controlling feelings of worry, and having sleep-related problems, such as insomnia.
My name is Anastasia Vanetex Kustanto, student number 128. I will explain the benefit and effects of Reiki for people with anxiety. Reiki has some benefits for physical and mental health. Reiki is effective for physical relaxation, reducing heart rate and also blood pressure. Based on studies, Reiki reduces depression and anxiety scores in patients with chronic pain condition, cancer, and elderly. Low depression and anxiety scores lead to better quality of life for patients in palliative care.
My name is Aini Putri, student number 141. Reiki requires no equipment or technology, is non-invasive, doesn't interfere with conventional treatments, and it's suitable for all age. Reiki generally appears to be safe and has no detrimental effect on the recipient. There are no known contraindications to Reiki. Reiki can be considered non-invasive and non-manipulating because it's delivered with a light touch or just above the body. It is also a non-pharmaceutical product. Occasionally, some people experience short-term discomfort after receiving Reiki. It's just that the body releases stress and toxin when it returns to a balanced state.
My name is Ferdinand with region number 108. So, about the conclusion, first, Reiki is a technique to stimulate the natural mechanism of restoration and maintenance of health using the laying of hands or touch. Relieving pain, reducing stress and anxiety, lowering blood pressure, and improving symptoms of depression and sleep problems are some of the health benefits of Reiki. Third, the Reiki principles are just for today. Do not injure, do not worry, be grateful, do your work, and be kind to others. Fourth, Reiki is used as a complementary therapy of other medical therapies, not as a curative therapy of any disease. Fifth, for patients with chronic illness, Reiki can be used as complementary therapy to reduce pain, stress, depression, and anxiety.
My name is Dias Vaskara, student number 168. Anxiety is part of human nature and is often unpredictable. It is a normal response of our body that prepares to face what it perceives as danger. It is commonly associated with fight or flight response. Reiki therapy is claimed to reduce anxiety, stress, and also depression. This therapy shows improvement of anxiety and depression score in patients with various chronic pain condition, cancer, and elderly people. Also, this therapy is generally safe and has no detrimental effect on the recipient, and there are no known contraindications to Reiki. Reiki can be considered non-invasive and non-manipulating because it is delivered with light touch or just above the body. This concludes our presentation. Thank you.